welcome to India TV. You're watching Health DNA. Well, residents of Delhi-NCR at this point of time are dealing with severe air pollution, something which has become a public health concern. AQI is deteriorating day by day. You must have seen visuals showing River Yamuna getting covered in poisonous froth. And all of this is affecting us. It affects our bodies, it affects our lungs. So what can we do to protect ourselves from this severe air pollution? Well, to answer all these questions, we have with us Dr Sarwinder Singh, Pulmonologist from Yatharth Hospital. Hello sir, welcome to India TV.
Thank you. I wish all the viewers of India TV season's greeting and happy Diwali to all of you.
Well, as sir said, Diwali is around the corner and I'm sure you must be excited to celebrate it with your friends and family. But one major concern, again, people can't burst firecrackers because of air pollution. So sir, what are the short-term and long-term effects of air pollution?
Okay, as for the effects of the air pollution concerned, short-term and long-term effects will be, in a short-term the effects will be burning eyes, skin rashes, and then there's irritation of the throat and headache. These are common short-term causes with exacerbation of asthma, exacerbation of COPD, breathlessness. These are common short-term causes of problems of pollution. As far as long-term effects are concerned, again, COPD is seen very commonly in patients who are exposed to pollution. Then we have a lung cancer problem in these patients. Very important to understand is that people who have prolonged exposure to pollution or remain indoor, they have a lot of cognitive disorders. They have a lot of mental problems like depression are quite common in these patients. These are things to be understood that these patients have these problems.
Okay. So sir, are there any particular demographic groups that are more prone to getting affected in this air pollution?
Yeah, as for the people who are more affected, we can call it like people who are young children and the old people or the patient who are already suffering from respiratory conditions. These are patients who are more affected when the pollution comes. We have seen the patients of COPD and asthma, their visit to the OPD is increasing these seasons. There are more admission during these seasons, COPD and asthma patients. There are more exacerbations. As for children and adults, old people are concerned, they have more common symptoms like children have cough, burning eyes. These are quite common in children. And similarly, the old people also get exposed and have these symptoms. Respiratory symptoms are quite common in them.
You said that children and old people. So how can we protect them? Both children and old people, what steps should we take?
Okay, as far as children are concerned, it's very difficult to control them from going outside. They'll be moving out, they'll be not restricted inside. But old people, yes, we can stop their morning walks or evening walks and they can be less exposed to pollution. But whenever they have to go out, children and the old together, they should be using masks properly. As for indoor pollution should be avoided. Keep the dust should be avoided at home. And you can use air purifiers when you are inside the house, especially where the small children are there in the room. And old people who are already suffering from respiratory illnesses or even not suffering from respiratory illnesses should be air purifier will certainly help in these patients.
Yeah, again I was about to come on air purifiers. Now there are more advertisements of air purifiers. So are these actually effective?
Yes or no, we can say that. And the air purifiers come in different variety, different ranges. Now a good air purifier which fits into your size of the room. One has to take an air purifier which is recommended for your room size should be used, and it should be a 5 to 6 layer purifier. We should be having HEPA filter and other filters should be used, and if properly used they are quite helpful, especially during night time when the children and the adults are restricted to a room. Otherwise when they move outside it won't really help, but once you are inside the room during night time it will certainly help these individuals.
What type of masks should people use so that it prevents the effects of air pollution?
Yeah, mask is a lot of issue as far as masks are concerned. You'll see a lot of people, ladies using chunni sometime, or the people just putting a handkerchief, wet or not wet handkerchiefs. Actually speaking, these masks, they really don't help. The only mask which helps you is a well-fitted N95 mask will help as the pollution is concerned, because the common elements and air pollution which harm your health is PM 22.5, PM10, sulfur dioxide and nitrogen dioxide. Now these pollutants will not be filtered with this homemade mask or the clothes, and one has to use N95 which filters your 2.5 up to 3 micron. 2.5 it may not filter properly, but at least up to 3 micron it can filter and protect you from these ill effects of pollution.
Okay. So, sir, we had a conversation about children, then old people. But what about those who are already dealing with other problems like heart problem or maybe asthmatic? So, how to protect, how can they protect themselves?
Well, as for the respiratory illness, chronic respiratory illness is concerned, asthma, COPD, ILD, it's a terrible time for them. And similarly, heart patients, they will always have an exacerbation of their symptoms during this exposure to pollution. The only advice to them is to avoid outdoor activities, use masks regularly, use the medications quite regularly. People have a habit of reducing the medication. We advise them to take the medication regularly, and at the first symptom or exacerbation of a symptom, you must visit your physician to take advice, and possibly there is a requirement of upgrading your medication which is required. We are already seeing there is a 15 to 20% increase as far as the COPDs are concerned. Patients of COPD are reporting with their symptoms, and the admission rates have already increased in these patients.
So, during severe air pollution, many people often feel the sensation of burning eyes. What can we do at that time?
You see, burning eye is quite a common symptom, especially the people who are on two-wheelers driving outside, and redness of the eye, burning eyes, this is a common symptom. The precaution what we advise to them is to use the protective eyeglasses regularly, and if the burning sensation is there, they must use the lubricant eye drops, that's methyl cellulose eye drops, and they must do the cold compresses when they go back home. And don't rub your eyes, that is the most important thing. Don't rub your eyes, it will harm you more. And even with these symptoms, these things, if it does not improve, then it's a time to visit your physician and have your health checkup done. This is the advice which we give to the patients.
Okay. So, generally, when we have like a throat infection or burning sensation in eyes, particularly if we talk about throat infection, this is the first symptom, I guess, of air pollution that you've been affected. So, people usually go to home remedies. So, what are the home remedies that are actually, impactful, that people should actually follow?
Well, I'll be no expert to give any advice on home remedies. Dadis can tell better. But whatever it is there, we have seen people using jaggery as a common thing, with sometime putting pepper with that.
So, is it beneficial or not?
As for the literature says, it is the gourd is supposed to be, or jaggery is supposed to be having some soothing effect on the throat. It is supposed to be anti-inflammatory. It boosts your immunity. So these are the possible reasons people are using it.
Yeah.
So I won't say it's a myth or it's a right or wrong thing. I leave the home remedies for the expert to advise. As far as I'm concerned, I will not like to substantiate or negate either of them.
So, sir, moving on from home remedies, as you said, when do you think that people should visit the hospital? They should go to a doctor. What are the symptoms?
Yeah. As we said, the common symptom which we see short term is irritation of the eye, throat irritation, pain in the throat, coughing, itching on the skin, or persistent cough or aggravation of your already patient was suffering from asthma, or the patient was suffering from COPD. When they are taking a regular medication and still not getting a relief, especially asthma and COPD patient, it's a time to go and visit a doctor, get your checkup done, and possibly it's a time to increase your medication and be regular on your medication. One should not avoid, because this is a time we have a lot of patients with exacerbation of COPD and asthma, especially who wait for some time and they're a little late to report. So advice is, whenever you have these symptoms, and after whatever home remedies you try, if it's not helping you, you must visit your doctor in time.
Okay. So, sir, I would come to our last segment. What are the preventive measures one should take, and what would be your message?
Yeah, as far as we have already mentioned some of the preventive measures which are there. The commonest is, of course, avoid outdoor exercises, outdoor ventures, unless very important to go outdoor, especially when AQI is very high. One should avoid early morning walks, late evening walks in this season. Use mask whenever you go to public places or go travel outside in polluted areas, and use proper well-fitted N95 mask to have a good benefit. Then you must have a good hydration, good diet, and which increases your immunity. These are the common things which you should do to avoid this side effects of pollution. And more important is, if you are suffering from any of these symptoms, it's the right time to visit your doctor in time. That's what the advice is for prevention.
So this was all in this segment of Health DNA. Thank you, sir, for answering all our questions. I hope our viewers have all the answers with them. If you like this interview, then do comment and let us know. Till then, keep watching India TV.